Some patients want as much information as possible about all of the treatment options, whereas other patients want to focus on a specific area or they have specific questions. Are you interested in a global overview, or would you like me to focus more specifically on certain details?
I'd like the fullest understanding that you could give me.
Okay. We'll do that. Unfortunately, the biopsies did show an area of prostate cancer. We took 12 biopsies, as you recall, and 2 of them had prostate cancer within them. The prostate cancer is evaluated as what's called a Gleason sum of 7. Are you familiar with the Gleason sum? So we've reviewed what led up to the biopsy, the PSA and the examination. We've reviewed what the biopsy results were, and I briefly mentioned what the treatment choices are for a man who's been diagnosed with prostate cancer. Before we go into more details, I just want to make sure that you understand all of that, and if there's anything about that that we need to go into in a bit more detail.
I guess what you're saying, Dr. Eastman, is that if I change my dietary habits and maybe exercised, that could do it. That could help solve my problem.
If I implied that, that was a little bit of an incorrect aspect of what I was telling you. I didn't want to suggest that by changing your diet alone, that was all you would need to do. There are some prostate cancers where dietary changes work well, but I wanted to emphasize that I don't think you have one of those types. I think this is the type of prostate cancer that will need to have treatment. And the treatment